The UNC Health Nash Foundation is a separate nonprofit that enables the hospital to invest in programs that improve the health of our patients beyond the four walls of the hospital.
Over the last several years, the Foundation Board has worked to align its mission and vision with the hospital's strategic plan, in particular around addressing social determinants of health, the barriers that our patients face once discharged that impact their ability to stay healthy.
The Community Paramedic Program provides at-home care for high-risk patients to reduce the likelihood of readmission. These individuals go into the home and can assess the patient's social environment and identify unmet needs related to factors like food insecurity, transportation, and access to health care. These ongoing wellness interventions empower patients to manage their health and minimize unnecessary ER visits.
In EMS, you have paramedics, and this is the same licensure in community paramedicine. We're just asking them to tackle more complex patients. We're asking them not only to assess an acute settings, we're asking them to manage chronic diseases. And then we're backing that up with a hospital model where we do have access to hospitalist teams that can help us problem solve through things. We can get patients connected to primary care, to specialty care. We're able to kind of outsource and help patients get to where they need to be. And it doesn't always necessarily have to be in the hospital, because we know patients that return quickly to the hospital have significantly poorer outcomes, because this isn't always the setting that they need to be in. And we want to keep patients happy and safe and healthy at home and empower them to stay there.
Part of the Community Paramedic Program is helping coordinate with primary care providers like myself. And they have done an amazing job of helping us identify barriers that many patients have that we would not know about until they came to an appointment with us, which might be several days or several weeks later. One of the things that I've seen that has worked really well with the community paramedics is really addressing medications and which medications patients should be taking after hospital discharge, and even going and getting some of those medications for patients who need them.
One of the biggest reasons why I have become and stayed a community paramedic versus being an EMS paramedic is my mother had a chronic illness. She had heart failure, and I watched her have to be sick and have a lack of resources and a lack of people to help, kind of being that change that you want to see in the world. And that's what we want to do, is we want to be the change, and we want to be the comfort and care for those patients who can't get any other resources, lack of insurance, or whatever it may be. I just want to be the change, and I want to be care and comfort for those patients who can't get it.
It's just very unique in the way that it's set up. It takes a lot of intimacy to allow someone to come into your home, a lot of trust, and have them know your full medical history, and to talk through that, and to really be vulnerable with them about what you need. Because that's what this program really is all about, is assessing for need.
These are programs that the hospital cannot get reimbursed for from insurance, so the hospital would not be able to sustain these programs without the generous support of our donors.
We know you have many choices in where to invest your philanthropic dollars. I'm here to tell you that your choice to invest in the Nash Foundation is critical for the success and sustainability of our community.
As a board member of the UNC Health Nash Foundation and a local primary care physician, I really have seen the impact that some of our programs have had on our most vulnerable community members. And I really think that the Community Paramedic Program has really been a life-saving program within our community.
It's also worth noting that we have no relationship with the UNC Foundation out of Chapel Hill, meaning no support from them, nor do any of your dollars go to them. All of the dollars invested in the UNC Nash Foundation stay local and go directly into supporting these programs that impact our patients.
And so that's why I choose to donate to the foundation, to help impact beyond the four walls of our hospital and help keep our community safe and healthy.
I would like to thank the hospital, the foundation, and all of our donors for allowing us to be the change and impact these patients outside the four walls of the hospital and help make our community healthier.
With your support, we can redefine the way healthcare is delivered, improving outcomes for our most vulnerable patients, reducing medical costs, and improving the overall health of our community.